Hello everyone in Katribu. My name is Vernon Velasco, and in place of Miss Cory, I'm going to interview the infectious diseases specialist at Makati Medical Center, Dr. Maria Tarcela Gler, to basically discuss the most common infectious diseases and how to prevent them. Hello po, Doktora. Good afternoon po. Yeah, so, ma'am, since we're talking about most infectious diseases, it just follows that the elephant in the room is COVID-19 po. Has it ever surpassed common flu in that regard po? Ay, ma'am, you're in mute po.
Sorry.
Yan. Yes po.
So, the common flu or seasonal flu, no, is
Yes,
something that is part of our infections that we meet every year. So, if you get the numbers, it depends on in this past 2 years. I don't know if the numbers have surpassed, but because we don't have the data yet for last year. No, but if you see from 5 years, then it's probably almost equal now. But of course, because this is something new, we call it an emerging infection. So mas mabilis yung transmission niya because a lot of people are not immune to that. So wala pa silang previous exposure dun sa bagong sakit na to, bagong infection na yun. So marami talaga yung mai-infect or mahahawa. Kaya hindi natin masasabi kung nag-surpass. Definitely sa hospitalization, nalampasan ng COVID-19 ang flu, no? Numbers of hospitalizations, numbers of deaths, in the past 2 years, nalampasan ng COVID-19 ang flu.
Pero ma'am, regardless of the cases, mas infectious po ang COVID-19 kesa sa common flu po?
Pareho lang actually yung kanyang merong tinatawag na RO or R0 or infectiousness level ang lahat ng infectious disease, no?
Apo.
So sa COVID po ay 2.
Yes po.
2 yung R0 niya or between 1 to 2. Depends on the pag maganda ang control, halimbawa dito sa COVID, kailangan nakamask o kailangan naka-social distancing, bumababa yung transmissibility niya, yung R0 niya. Yung flu is almost at that level or lesser dahil syempre meron ng bakuna ang flu, kaya mas mas less transmissible because of the years of vaccination program ng flu.
Yeah. Yeah, Doctor, now that we have actually a lot of strains of new strains po in the spectrum po, how should we think po of emerging infectious diseases in a new way? Kasi di ba po we have Delta variant na parang ganyan.
Sa COVID.
Yes po, ma'am.
So gusto natin malaman kung bakit nagkakaroon ng variant. Ito ba yung tanong?
Yes, ma'am. How are they popping up po? Yung mga bagong variants na yan.
So, ang lahat ng infectious disease po, viruses o bacteria, ang natural na natural na nangyayari pag dumadami siya, nagkakaroon siya ng mutation.
Opo.
So, kung inaalaw natin siyang dumami, ibig sabihin pag ang gusto kasi ng virus makapunta siya sa tao na sa host para dun siya dadami.
Yes po.
So, habang merong mga vulnerable o hindi pa bakunado o hindi pa nagkaroon ng infection before, lilipat siya ng lilipat. Mas mabilis siyang lumipat. So, the more it divides or mas pag inaalaw natin siyang lumipat, nangyayari yung mas mabilis din siyang mag-mutate. Kaya madami tayong nakikita ngayong mga mutations because because of the transmissibility o hindi napipigil yung pagta-transmit. So, ang ginagawa dito para mapigil yung transmission is mag-vaccinate or kaya kung marami na yung na-infect, syempre sila mas immune na. Ang inaano natin na tumaas yung kaso o yung dami ng mga tao na mayroong immunity doon sa virus para hindi na sila vulnerable. Kumonte yung mga vulnerable na tao. So the only way we can do this is one is to vaccinate. Of course, yun yung most effective is to vaccinate. At kung yung isa is yung natural infection, no? Na hindi natin syempre pwedeng i-allow yung natural infection dahil sa natural infection may marami ring mamamatay.
Yes,
the vaccination is the safest way to attain yung tinatawag na herd immunity.
Yeah, ma'am, but since we're talking about vaccination nga po, no, we had scrambled for at least a year to develop vaccines po. But are the vaccines being rolled out now can still address po the new variants coming up?
Meron ng mga datos, no? Of course, kasi bago yung variant, so titingnan pa natin yung gaano ka-effective. Yung mga bakuna na inilabas noong 2020, syempre na-test sila dun sa wild, yung original na COVID-19, original na klase, no? So, ngayon, nung pagdating ng mga bagong variants, nakita na may mga bakuna na effective siya, like yung Johnson & Johnson, nakita na effective siya dun sa South African strain, yung Astra, at saka yung Pfizer and Moderna, ay effective siya dun sa UK strain. Yung Delta, dahil siya yung pinakabago, wala pang masyadong datos. Titingnan pa yung datos about that. But for the previous, yung mga alpha, yung hindi ko pa memorize yung mga Greek names ng mga may nakita ng mga bakuna na effective yung certain vaccines on that strain.
Yes, ma'am. Yeah, Dr. we have been hearing about resistance po, holding our path to herd immunity or population immunity for that matter. What are the concerns, the most common concerns you are actually receiving from potential from these recipients po that have actually consulted with you? But before you answer that, we're going to take a short break po.
All new Bayad.
Make long distance easy with the Mirage G4.
Wala na siyang boses. Hindi ko na...
Doctora? Hello?
Yes.
Kaya po, ma'am, regarding the vaccine resistance nga po, no, what's the most common po reason why people are resistant based on those who've consulted with you?
Vaccine resistance regarding COVID vaccine, you mean?
Yes po. Yes, ma'am.
Okay. So, it's not necessarily vaccine resistance, no? Dahil nga may bagong variant, so yung vaccine na yon was originally made for a certain strain.
Yes po.
So, kung may bagong strain, hindi na effective yung bakuna na yun o hindi nako-cover yung bakuna na yun dun sa bagong strain. Ayan. Halimbawa, yung flu vaccine, no? So, every year, iba-iba yung nag-circulate na strain.
Yes po.
So, ang ginagawa ng WHO every February, ina-identify niya kung ano yung mga most common strains from last year, tapos yun yung inilalagay dun sa panibagong bakuna. Yung strains na yun na nakita last year. So yun yung ibabakuna for this year. So baka ganun na rin ang mangyayari sa dahil nga mabilis mag-develop ng mutation, mag-develop ng panibagong strain, COVID, ganun na rin ang mangyayari noon. So ngayon, gumagawa na ng bakuna ulit dahil nga siyempre sa ating panibagong teknolohiya, it's faster to make vaccines, no? So, they're making those vaccines that are specific for certain types of strains. So, whatever will be circulating, ma-address yon with the development of new types of vaccine. And it's not, hindi yun magsa-start ulit from zero, no? Lang naman, yung mayroon lang iti-tweak para i-test siya sa certain numbers of healthy population para makita yung effectivity and then ma-roll out na kaagad siya. Parang flu vaccine.
Yes, ma'am.
Mabilis lang siya ma-roll out.
Yes, ma'am. So, ma'am, you're saying in case po the Delta variant actually spread wholesale, knock on wood, yung mga na-roll out po natin ng mga bakuna will be rendered useless if that happens po?
Sinabi ko na nga kanina, di ba? Hindi wala pang masyadong data. It could be, wala pang masyadong data kung itong mga bakuna, na marami ng bakuna ngayon, na lumabas ay ineffective sa Delta strain.
Okay po.
So, tingnan pa yun. Now, kung hindi man siya effective, they can easily tweak that to make it effective for Delta strain. Okay?
Yes po. Ma'am, are asymptomatic and pre-symptomatic patients po less contagious for that matter?
Ito yung ang going back to coronavirus, no? Ang coronavirus at saka kasi this is common infectious diseases. Hindi lang siya ang topic natin, di ba? Hindi lang coronavirus, pati mga flu. So, yung flu at saka itong common respiratory viral infections, no, mayroong tinatawag na incubation period. So, mayroong stage na wala pang nararamdaman ang tao bago siya yung maging sick, no? So, ito yung tinatawag na pre-symptomatic period, no? So, para sa COVID, 3 days yon na nakakahawa sila bago sila magkaroon ng sintomas. Like sa flu, 1 to 2 days, bago sila magkaroon ng sintomas, nakakahawa na sila. So, pareho lang yung yung ability to transmit the disease is the same as when, of course, kung mas symptomatic sila, mas nakakahawa sila kasi di ba mas inuubo nila yung ka-droplet kasi tayo nahahawa. So, mas nakakahawa sila pag symptomatic.
Yes, ma'am.
Yun.
Yes, ma'am, let's veer away. Yeah.
Sa symptomatic, hindi sila ganun ka nakakahawa. Pero it doesn't mean na hindi sila nakakahawa. Nakakahawa pa rin.
Yeah. Yeah, ma'am, let's veer away from corona nga, no? What are the most common infectious diseases po?
Napakadami.
Yes po.
Common infectious diseases.
Kasi po, di ba po,
if you go by the top 10,
yes po, top 10.
Causes of morbidity and mortality, yung dito sa Pilipinas, ang nandoon pa rin na mga top, kasama sa top 10 na infectious diseases are one, yung pneumonia.
Yes po.
Ito yung usual causes of hospitalization kasi ito yung nire-report sa Department of Health. Pneumonia, diarrheal diseases, yung diarrhea, gastrointestinal diseases, at saka TB ay kasama pa rin. Tuberculosis ay kasama pa rin sa top 10. Now, ang isang infectious disease that is a concern dito sa ating country because it has been increasing since 2008 ay yung HIV. Kasi isa tayo sa mga mabilis ang pagtaas ng HIV rate.
Ma'am, dumadagdag pa po ba yung mga listahan? May nadadagdag pa po ba year on year?
Saan? Anong listahan?
Sa listahan po ng infectious diseases na meron tayo?
Merong tinatawag, constant naman ang mga infectious diseases na
yes,
meron tayo na umiikot. Of course, merong tinatawag na emerging infection. Isa ito. So, emerging infection meaning hindi siya dati of concern tapos bago siyang sakit, bagong infection, like with coronavirus. Dati nang merong coronavirus, no, kasi cause naman siya ng common cold, pero hindi siya gumagrabe. So, ngayon lang lumabas itong COVID-19 na grabing infectious disease, kaya emerging infection tawag natin. At yung isang sinasasakop ng emerging infections are yung mga na hindi na siya dati, parang napa-zero na natin at biglang tumaas ang rate. Katulad ng polio, 3 years ago, nagkaroon tayo na naman ng zero polio na tayo, tapos biglang meron na ulit tayong polio. So, sasama yun sa listahan ng mga emerging infectious diseases.
Yes, ma'am, how in your assessment po, how resilient is the Philippines po in addressing infectious diseases? Now,
how prepared or how?
Yes, how prepared po and how resilient?
Prepared. So, sa regular na paano mong gustong tingnan? I-rate yung programs natin and how
yes po.
We are prepared in dealing infectious diseases. Siyempre, titingnan mo yan sa iba-ibang programa ng control, no? Sa bawat infection. So, ang pinaka-effective way to control infectious diseases is through vaccination, no? And we have our expanded program of immunization para sa mga bata. So, this usually covers less than 5 years old. So, ang coverage natin sa bata sa immunization coverage natin for measles, for TB and tetanus and diphtheria has been high. Traditionally, bumaba lang siya yung pre-pandemic years, medyo bumaba ang coverage natin. Nagkaroon ng lamat yung ating coverage dahil doon sa nangyari tumaas ang vaccine hesitancy natin dahil doon sa sa dengue issue, no?
Yes po.
So, at nagkaroon yun ng epekto dun sa ating immunization program.
Yeah.
Buti na lang ngayon, dito naman sa ating immunization program or rollout ng COVID, tumataas naman ang ating rate of acceptance. No? Nakita naman ng WHO na hindi ganon kataas ang ating vaccine hesitancy rate. But, of course, yung problema sa atin is supply kasi hindi pa tayo konti pa lang doon nga sa numbers of yung sa listahan ng mga countries regarding their response, yung grade natin dun sa response to COVID, nasa mababa tayo. Kung sa 53 countries na number 52 tayo. So hindi ganun kaganda in the international standard yung control natin on coronavirus.
Yeah, ma'am. Yeah, to get to know infectious diseases more in a fun way, we're going to play fact or fiction game. So we're going to flash a statement on the screen and then you're just going to say if it's true or false, ma'am. Okay. Here goes.
Yung maglalaro.
Yes, po. Okay. Signs and symptoms vary depending on the organism causing the infection, but often don't include fever and fatigue. Fiction. Yes, ma'am. Can you elucidate more on that po?
Kasi ang sinasabi dito, iba-iba ang manifestation ng infection. Statement, iba-iba ang manifestation ng infection, pero hindi usually kasama ang fever at fatigue. So, may mga infeksyon na minsan walang lagnat, pero karamihan ng infeksyon ay magpapakita ng lagnat. Fever is actually one of the response of the body kung merong infection.
Yeah.
It's a common response of the body kung merong infection. Pag mga viral infections, ang most common response ay yung sakit ng katawan. So, yung dengue fever, flu, kaya nga flu-like symptoms yung mga sakit ng katawan. So, yun yung most common manifestation ng infection. So, fever is usually kung merong lagnat, palaging iniisip ng mga tao merong pang infection. Although hindi lahat ng lagnat ay dahil sa infection, but most of the time kung may lagnat, we always think of infection.
Yeah. Next question, please. Okay. Many infectious diseases such as measles and chickenpox can be prevented by vaccines. Frequent and thorough hand washing also helps protect you from most infectious diseases. Fact. Yeah, ma'am. Please elucidate po.
So, ang infection, no, yung pag-transmit ng infection ay depende sa type ng infection. Merong mga infections na natatransmit through yung paghinga. So, sa hangin. Meron katulad ng TB at saka measles, no? At saka chickenpox. So mabilis masyado ang paghawa ng mga ganitong klaseng infection. In fact, yung chickenpox, ang RNAT niya ay maabot ng 5. So, yung RNAT ng COVID, no? Yun yung alam ng mga tao ngayon ay 2 or less than 2. Ang chickenpox, abot na ng 5. So, yung may mga infection naman na nahahawa ka sa pagkain, sa mga contaminated na food. No? May infection naman na nahahawa ka through droplet infection, yung mga common cold. So ito, nahahawa ka nito sa malapitan. Pag respiratory infection, yung pag sa hangin, nahahawa ka kahit na malayo. So, may mga infection naman na mahahawa ka pag yung mga napupunta siya sa surfaces, pag tinouch mo yung surface na yun, ay at pupunta ilalagay mo yung iyong kamay sa mata mo at sa bibig, pwedeng ganun ang pamamaraan ng pagkahawa. So pag ganoon, ang klase ng paghawa, kailangan talaga ang paghugas ng kamay. So most of the infections, ang pinaka-importanting intervention sa infection control ay paghugas ng kamay. Hand washing is the single most important method of intervention in preventing infection control, in preventing infection. Kaya araw-araw meron tayong advertisement sa hand washing dito sa mga hospital kasi kailangan matandaan ng lahat ng tao na hand washing is very important. Lalo na ngayon na pandemic, no, ito yung pinaka natatandaan palagi ng tao, maghugas palagi ng kamay.
Ma'am, yung next statement, I think you've answered it already. So it's an easy way to catch most infectious diseases is by coming in contact with a person or an animal with the infection. So, ayun nga po yung, nasagot yun na kanina. So, next question. Most infectious diseases have only minor complications, but some infections, such as pneumonia, AIDS, and meningitis, can become life-threatening.
Pwede siyang fact, pwede din siyang fiction, kasi hindi siya ganun ka-accurate yung statement dahil depende din yun sa tao yung minor complications. Halimbawa, sa COVID, 90%, di ba, minor lang. Flu, almost 90% will recover after 10 days. Pero pag matanda, bata, may diabetes, hypertension, so pag may ibang mga sakit, pwede siyang maging grabe at pwede siyang makamatay. So, yun. So, depende sa klase ng infectious disease at sa host, dun sa may infeksyon. Kasi pag matanda at bata, masama ang infeksyon kasi mahina pa ang immune system nila. Pag may HIV, yung tao, hindi naman yung HIV ang nakakamatay. Yung ibang infeksyon na tumitira sa tao na merong HIV, yun yung nakakamatay kasi bumababa ang immune system nila. So, depende dun sa host. Kung maski na mild na infection, pag yung host ay mahina ang katawan, mahina ang immune system, nadadali siya. So, grabe yung infection sa kanya.
Yes, ma'am. Salamat po. Ma'am, it has been a delight to have you here at Kalingang Katribo po. As a parting word po, can you say that the pandemic going around now has made us more wary of infectious diseases?
Not worry, maybe more aware.
More aware.
Of infectious diseases. Kasi ito na lang yung araw-araw, naririnig natin at nakakabagabag sa atin. So at least knowledge is power. So if you know about the disease, at alam mo kung paano i-protect ang sarili mo, alam mo kung paano ang mga prevention na gagawin, hindi ka dapat natatakot sa infectious disease. No? Kasi meron naman ang infectious disease na gamot. Siya ay luma na o kaya may bakuna. Pwede siya ma-prevent. So, ang pinaka-importante, alam natin kung anong gagawin. At alam natin kung kailan tayo magpapakonsulta. Okay?
Ayan. Yes po, ma'am. Dr. Maria Tarcela Gler, maraming salamat po. Magandang hapon. Yeah.
Maraming salamat din.
Thank you po.
Learn on.
Sige po.
Bye-bye.
Yeah, and that's it for today's Kalingang Katribo. My name is Vernon Velasco. Good afternoon.